Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about the mechanics of a stellate ganglion block and one of the most surprising things to patients about receiving a stellate ganglion block. So when a patient has consented to do a stellate ganglion block and understand the risks and benefits, and we've had a discussion of how the stellate ganglion block can help that individual patient, generally hypervigilance, PTSD, generalized anxiety, then the patient climbs onto the procedure table, facing up to the sky, and rests their head on a pillow. And then we turn the head gently to the side and use ultrasound jelly and clean off their neck with an alcohol wipe, and then use the ultrasound probe to find the locations in the neck at the cervical 4 and cervical 6 vertebrae. And then we use a very tiny needle that's called an echogenic needle because it literally can be seen on ultrasound, which is the echogenic part. So it's a special needle that can be seen on ultrasound, and it's a 22 gauge needle. So for those of you who know needle gauges, that's very, very small. And we place that through a numbed area on the skin at C4 and C6. And that needle leaves medication right next to the stellate ganglion, which creates a pocket of medication around the stellate ganglion. And the medication that we leave there is a sodium channel blocker called bupivacaine, which is a numbing medicine that starts working slowly over a half hour and finishes working over about 8 to 12 hours. And then as soon as about 5 milliliters of that medication is in the C4 area and the C6 area, then we remove the needle and you're done with the procedure. And usually the procedure doesn't take even very much longer than how long we've been talking about it. The longest part of the whole procedure is scanning the neck with the ultrasound probe to find exactly the right locations because the neck is very valuable real estate, so there's a lot going on. But with the ultrasound probe, we can see the relevant vasculature like the carotid artery, the internal jugular artery, the brachial plexus, which is the nerves coming out of the spine that control the shoulder and the arm. And we can see the stellate ganglion, which is the little bundle of nerves that is the sympathetic outflow from the brain to the rest of the body. So that runs in generally a very specific, very similar across all patients area. And we find that area on the ultrasound, and you can see the needle as it passes through the tissues to be directed right to that area. So it helps us take all the precautions to make sure that, one, we're doing the procedure and getting the exact right area, and two, that it's as safe as possible. I think what most patients are surprised by right after a stellate ganglion is how quick and easy the procedure is. I think it's very intimidating to a lot of patients to have the idea of a needle going into their neck. But I've had so many patients comment that it was easier than having an IV placed because they can't see it. You can't watch it like an IV or like a flu shot. And I talk them through the whole thing so that it's a little bit of a distraction to be talking to them. And the ultrasound probe is kind of running over the surface of the neck, which is the majority of what patients experience as the sensation of having the block. So most patients are very surprised by how little they notice of actually having the block placed, and how quick the block procedure is. Generally, from the start of having the patient lay down and scanning their neck to finishing the block, it takes about 5 to 10 minutes, usually closer to the 5 to 6 minutes. And it's generally very well tolerated, very comfortable. And even the kind of weird symptoms that we see afterwards as the Horner syndrome that we expect after a successful block, a lot of patients are very intimidated by the idea of having a droopy eye or having the swallowing, and they're very worried that it's going to be very uncomfortable for them for, the 8 hours afterwards. But most patients are very pleasantly surprised that it's not very uncomfortable. It's definitely a weird feeling. And it's an unusual feeling, but it's not as uncomfortable as they um, perceive it's going to be. I think it definitely exceeds their expectations for being very tolerable.